I am Linda. In this video, I shall explain some of the different types of arthritis, and why you can develop more than one type simultaneously, how you can manage coexisting arthritis and much more, but first I shall explain multiple types of arthritis. Arthritis is a term that refers to a group of disorders affecting the joints causing pain, swelling and stiffness. Many people are familiar with the common types, such as osteoarthritis and rheumatoid arthritis. However, there exists a lesser-known aspect of this condition, where individuals can experience multiple types of arthritis simultaneously. This is called coexisting arthritis or polyarthritis. There are over 100 different types of arthritis, each with its unique characteristics, causes and treatment methods. Each type presents distinct challenges that affect people of all ages, genders and backgrounds. Despite the variety in the types of arthritis, they share common features such as joint pain, swelling, and stiffness. These symptoms can range from mild discomfort to devastating and can have a big impact on your quality of life. Additionally, certain types of arthritis can affect the body's organs and systems, making early diagnosis crucial to prevent further complications. Multiple arthritis, also known as polyarthritis, refers to a condition that has inflammation and pain in multiple joints and organs throughout the body. Unlike specific types of arthritis that affect only one or a few joints, polyarthritis involves the concurrent involvement of 5 or more joints. This condition can be caused by various underlying factors and may present a significant diagnostic and treatment challenge for healthcare professionals. In some cases, polyarthritis may develop as a secondary symptom of other systemic diseases, such as viral infections or connective tissue disorders. Symptoms of multiple arthritis are like those of other forms of arthritis, including joint swelling, stiffness, tenderness, and reduced range of motion. However, the widespread nature of the condition can lead to more severe and devastating effects on the affected person. Diagnosing multiple arthritis requires a full assessment by a healthcare professional. This could be medical history, physical examination, blood tests, and X-ray. Identifying the specific type of arthritis is essential for determining the most appropriate treatment plan. Treatment for multiple arthritis often involves medications to reduce inflammation and pain, physical therapy to improve joint function and mobility, and lifestyle changes to manage the condition effectively. In some cases, disease-modifying anti-aromatic drugs may be prescribed to slow down the progression of the disease and prevent joint damage. Living with multiple arthritis can be challenging both physically and emotionally. Chronic pain and limited mobility can significantly impact your quality of life, leading to fatigue and emotional stress. Support from family and friends can play a vital role in managing the condition and maintaining a positive outlook. Research into the causes and treatment of multiple arthritis continues to advance early diagnosis and appropriate management, which are crucial in minimizing joint damage and improving the overall well-being. Before discussing the possibility of coexisting arthritis, it is crucial to understand the different types of arthritis. There are 2 common types of arthritis, which are osteoarthritis and rheumatoid arthritis. Osteoarthritis is the most common type of arthritis, often associated with age-related wear and tear on the joints. It affects the cartilage, which protects the tissue covering the ends of bones, leading to joint pain and stiffness. But rheumatoid arthritis is an autoimmune disorder that occurs when the immune system mistakenly attacks the synovium, which is the lining of the membrane surrounding the joints, that causes inflammation leading to joint damage and pain. Coexisting arthritis is a complex medical condition that can affect you when you are already struggling with one form of arthritis. With the right care and support, you will be able to improve your quality of life. If you suspect you have multiple types of arthritis, you should go to a qualified doctor for an early diagnosis and a personalized plan. Having multiple arthritis makes the management and treatment of the conditions more complex, and dealing with this presents several challenges that include: Number 1, identifying and diagnosing. Number 2 is the complex of treating both together, as each type of arthritis requires a tailored treatment approach, such as physical therapy. Number 3 is the progression of the disease that could interact between different types of arthritis, meaning that it can worsen the joint damage, and disease could progress, leading to increased pain and disability. And number 4 is the emotional impact. Managing one type of arthritis can be emotionally tough. However, dealing with several conditions can result in heightened stress, anxiety, and frustration. Although living with coexisting arthritis can be challenging, there are effective ways to manage the conditions. Number 1 is getting an early diagnosis. seeking prompt medical attention and accurate diagnosis. This enables your medical professionals to develop a comprehensive treatment plan that covers all the different types of arthritis that you have. Number 2 is having a treatment that includes many approaches involving a medical team, including rheumatologists, physical therapists, counseling, and other healthcare professionals. They can help by developing a well-rounded treatment plan, tailored to your needs. Number 3 is managing your medication. Some may be for treating one type of arthritis, but may interact with those used for another, therefore close monitoring and adjustments by medical professionals are necessary. And number 4, modifying your lifestyle, engaging in regular exercise, maintaining a healthy diet, and reducing the impact of stress can improve overall well-being and reduce the effects of arthritis symptoms. The link to psoriatic arthritis and psoriasis are chronic conditions that affect millions of people worldwide. Understanding the link between psoriatic arthritis and psoriasis is crucial for early diagnosis and effective management. Psoriasis is a chronic autoimmune skin disorder. It happens by a rapid buildup of skin cells, resulting in thick red and scaly patches. These patches, known as plaques, can appear on the scalp, elbows, knees, lower back, and other areas of the body. Psoriasis is not contagious, but it can have a significant impact on a person's physical and emotional well-being. The exact cause of psoriasis is still not fully understood, but it is believed to be linked to an overactive immune system. Genetics, environmental factors, and certain triggers can contribute to its development. Stress, infections, injuries to the skin, and certain medications are known triggers that can worsen psoriasis symptoms. Psoriatic arthritis, however, is an inflammatory joint condition that occurs in some people who have psoriasis. It is estimated that up to 30% of people with psoriasis will develop psoriatic arthritis at some point in their lives. Psoriatic arthritis can cause joint pain, swelling, and stiffness, often affecting the joints. These joints include your fingers, toes, knees, and ankles, and sometimes the spine. Like psoriasis, the exact cause of psoriatic arthritis remains unclear. It is thought to be an autoimmune disorder where the immune system mistakenly attacks the body's tissue. Genetic factors also play a role in the development of psoriatic arthritis. The symptoms of psoriatic arthritis can vary significantly from person to person. Some common signs include: number 1, your joints becoming painful and swelling. Also, they will feel tender in the affected joints. The pain may range from mild to severe. Symptom number 2 is psoriatic skin lesions which look like psoriasis, and number 3 is reduced range of motion, which can lead to stiffness in the affected joints, making movement difficult. Number 4, you may have pitting, discoloration, or separation of the nails from the nail bed. Number 5 is chronic inflammation and pain that can lead to fatigue and a general feeling of sickness. Psoriatic arthritis diagnosis needs a thorough medical examination, including a physical exam and imaging tests such as X-rays and MRI scans. Treatment for both psoriasis and psoriatic arthritis aims to alleviate symptoms, reduce inflammation, and slow the progression of the disease. If you have mild psoriasis, you may be given a topical cream or ointment that can be applied directly to the affected area. In more severe cases, oral or injection target the immune system may be prescribed for you. These types of medication can manage both skin and joint symptoms. Physical therapy can help improve joint function, reduce pain, and increase mobility. Ankylosing spondylitis is a chronic inflammation that mainly affects the spine and sacroiliac joints, causing pain, stiffness, and reduced mobility, and the axial skeleton, leading to the fusion of the vertebrae and possible impairment if left untreated. The symptoms of this disease can vary from person to person, and the condition often develops gradually over time. The most common signs and symptoms include back pain and stiffness that can become persistent, progressive, and can become worse in the morning or after periods of inactivity. Therefore, a fusion of the spinal vertebrae that can lead to reduced flexibility and limited range of motion in the back. You could also develop pain and inflammation in other joints. Besides the spine, you may have pain and swelling in the hips, knees, shoulders, and ankles. Other symptoms are fatigue, inflammation, and pain, which can lead to fatigue and a general feeling of illness. You may also develop eye inflammation, called uveitis, which is inflammation of the eye and causes redness, pain, and sensitivity to light. The exact cause of ankylosing spondylitis is not known, but genetics and environmental factors play a part. The condition most commonly appears in late adolescence or early adulthood, affecting men more frequently than women, or a family history of ankylosing spondylitis. Ankylosing spondylitis can be challenging as the symptoms may resemble those of other conditions affecting the spine and joints. A diagnosis may be a thorough medical history, physical examination, and imaging X-rays and MI scan. Early diagnosis is crucial for effective management and to prevent long-term complications. With all arthritis, there is no cure, but various treatments aim to control symptoms, reduce inflammation, and improve the overall quality of life. Treatment options may include non-steroidal anti-inflammatory drugs. These are commonly used to reduce pain and inflammation, or you may be given disease-modifying anti-aromatic drugs in more severe cases. Biologic therapies can target specific components of the immune system and have shown promising results. You could also have physical therapy, or it would be best if you had regular exercise, maintained proper posture, which strengthens the muscles around the affected joints, or pain management like heat and cold therapy may be recommended. The next is gout. Yes, gout is a type of arthritis that is a common joint disorder. It is a specific form of inflammatory arthritis, caused by the buildup of uric acid crystals in the joints. It is considered to have a sudden or severe bouts of joint pain, commonly affecting the big toe. Uric acid is a waste product formed when the body breaks down purines, which are natural substances found in certain foods and tissues like sugar. When uric acid levels become too high in the blood, a condition known as hypothermia is formed. This excess uric acid can crystallize and deposit in joints, tendons, and surrounding tissues. These crystals trigger an immune response, leading to intense inflammation and chronic pain, often referred to as a gout attack or flare-up. Gout is mainly caused by dietary choices, genetics, obesity, and certain medications. While both arthritis and gout involve joint inflammation, the symptoms can differ. Gout often presents a sudden intense pain in the affected joint. The affected joint may become red, swollen, and extremely tender. During a gout attack, the treatment can be treated with non-steroidal anti-inflammatory drugs or corticosteroids to reduce pain and inflammation. Your lifestyle changes could include changing your diet. If you are overweight, you should try and lose some. The last one is lupus, which is another autoimmune disease that can cause inflammation in the joints. Lupus and arthritis are two distinct medical conditions that involve inflammation and affect the joints and other body systems. This chronic and complex condition can affect multiple organs, including the skin, joints, kidneys, heart, lungs, and blood vessels. The exact cause of lupus remains unclear, but it is believed to involve a combination of genetic, environmental, and hormonal factors. Certain triggers such as stress, infections, sunlight, and certain medications may worsen the symptoms. If you are vulnerable, common signs of lupus include: number 1, fatigue, which is a dominant symptom often due to inflammation and the body's immune response. Number 2 is skin rashes that may develop on the face like a butterfly shape across the cheeks and nose. Your skin may also be sensitivity to sunlight. Number 3 is joint pain and inflammation, which resembles symptoms of arthritis and can affect multiple joints. Number 4 is that you could have an unexplained fever during disease flares. Number 5 can involve kidney damage leading to protein or blood in the urine. And number 6 is your fingers and toes, which may turn white or blue in response to cold or stress due to restricted blood flow. Lupus-related arthritis typically involves symmetric joint inflammation, meaning it affects joints on both sides of the body. It tends to be milder than other forms of inflammatory arthritis like rheumatoid arthritis. Diagnosing lupus involves a medical history, physical examination, blood tests, and X-rays or scans. The management of lupus aims to control inflammation, reduce symptoms, and prevent disease flares. The treatments could include non-steroidal anti-inflammatory drugs. These can help manage joint pain and inflammation, or disease-modifying anti-aromatic drugs. These may be used to control the underlying autoimmune response. You could have corticosteroids, which are potent anti-inflammatory medications that are often prescribed to control severe symptoms. Immunosuppressants are used for more severe cases that suppress the immune system and may be necessary to prevent organ damage. Regular exercise, a balanced diet, and stress management can all help to prevent or reduce the disease. If you think you may have multiple types of arthritis, it is important to see a doctor for an early diagnosis. Your doctor will likely do a physical exam and order tests such as blood tests and X-rays to help determine which types of arthritis you have. Once you have been diagnosed with, say, osteoarthritis and psoriatic arthritis, your doctor will work with you to develop a treatment plan that is right for you. With the right treatment, you can manage multiple types of arthritis and live a full and active life. In conclusion, multiple types of arthritis include varied and complex symptoms, ranging from joint-related diseases that affects millions of people globally. While each type of arthritis has its unique features, triggers, and significances, they all share the common burden of joint inflammation, pain, and reduced mobility. These symptoms can significantly impact your daily life, leading to challenges in performing even the simplest tasks. Early detection can make a significant difference in managing disease progression and improving your overall well-being. Continued research and medical developments in the field of arthritis is developing better therapies and possibly even finding cures. I am not a medical professional and this video is for information only. If you are worried about anything, you should consult your doctor or healthcare professional. Thanks for watching this video. If you found it helpful, then please click the subscribe button to follow my channel and click the bell. If you have any questions, please leave a comment below. I hope this has helped you and good luck.